Hi, welcome back to my channel. I'm Dr. Kathleen Jude Estime, psychiatric nurse practitioner, and today we're talking about understanding the chemicals in our brain that affect depression and anxiety. I hope you learned something, and if you do, please like, share, and subscribe, and let's get into it. Hi everyone, today we're going to talk about some important chemicals in the brain that are connected to feelings of depression and anxiety. Let's break it down so it's easy to understand. First, let's talk about what depression and anxiety are. Depression is essentially when someone feels sad, empty, or hopeless for a long time. Anxiety is when someone feels worried or scared even when there's no threat or no reason for it. Did you know that our feelings are influenced by chemicals in our brains? That's right. These chemicals are called neurotransmitters. They help send signals between brain cells. One key neurotransmitter is serotonin. Serotonin helps control our mood, emotions, and feelings of happiness. When there isn't enough serotonin in the brain, it can lead to depression. It's like if you don't have enough fuel in your car, the car can't run properly. To help increase serotonin levels, doctors and nurse practitioners often prescribe medications called antidepressants. One common type is called a selective serotonin reuptake inhibitor, or an SSRI. Some examples are fluoxetine, which is commonly known as Prozac, and sertraline, which is commonly known as Zoloft. Another important neurotransmitter is dopamine. Dopamine is often called the feel-good chemical because it's linked to pleasure and reward. When we do something enjoyable or achieve a goal, our brain releases dopamine. Low levels of dopamine can make us feel unmotivated, and that can happen in both depression and anxiety. For those struggling with low dopamine levels, nurse practitioners might prescribe medications called dopamine agonists. We also have a neurotransmitter called norepinephrine. Norepinephrine is involved in the body's fight or flight response. This means it helps us react to danger. When someone is anxious, their norepinephrine levels may go up, which can make them feel tense or on edge. To help manage norepinephrine levels, medications called norepinephrine reuptake inhibitors can be used. For example, venlafaxine or Effexor is an antidepressant that helps balance norepinephrine and serotonin. In addition, there's another neurotransmitter called GABA. GABA helps calm the brain down. Think of it as the brakes on a car, slowing things down. Low levels of GABA can lead to increased anxiety because there isn't enough calmness in the brain. To increase GABA levels, nurse practitioners might prescribe medications known as benzodiazepine, like lorazepam or Ativan or Valium. But these are usually used for short-term relief because they can be habit-forming. So to recap, here are some main chemicals we talked about. Number one is serotonin, which helps with mood and happiness. Medications like SSRIs can help balance this. Number two was dopamine, linked to pleasure and motivation. Dopamine agonists can help. Number three was norepinephrine, involved in stress and anxiety responses. Norepinephrine reuptake inhibitors are useful here. GABA calms the brain down. Medications like benzodiazepines can increase GABA activity. When someone has depression or anxiety, these neurotransmitters might not be balanced. This means that they might not feel good, happy, or calm like they want to. It is important to know that if someone is feeling this way, they should talk to someone who can help, like a counselor or a nurse practitioner. There are treatments available that can help balance these chemicals and improve feelings. Thank you for listening. Understanding our brain and chemicals can help us learn more about how we feel. Remember, it's okay to ask for help if you're feeling down or anxious. See you next time.